name is Valeria Santini. I'm the chair of the MDS unit at the hospital, the University of Florence in Italy. And what I would like to discuss with you today is the importance of chronic anemia in patients with myelodysplastic syndrome. So chronic anemia is the main cytopenia and the main problem we face with these patients, with this kind of patients. These patients are elderly. They have quite frequently comorbidity and cardiac disease that may impact on the symptoms of anemia. So treating anemia and resolving anemia in some way, it's a very important step. So these patients can receive erythropoietic stimulating agents like EPO, and they can respond for a long time, couple of years, and then they usually become transfusion dependent. And then we have to organize the management of transfusions and the symptoms that are oscillating when the patients receive these transfusions. And then we have now a couple of drugs that have been recently approved that are able to obtain transfusion independence in patients who achieve transfusion independence. Now, as you may imagine, the management, the caregiver, and the patient have a decreased quality of life because of the anemia and because of all the implication of anemia, not last the fact that they have to come to the hospital very frequently for receiving transfusions. And the two drugs that have been approved are luspatercept, that has been approved many years ago already, 4 years ago, for the treatment of transfusion-dependent, low-risk patient with MDS with ring sideroblast. And in this case, the achievement of transfusion independence is really important, although this has been really improved by the use of luspatercept, not in patients who have received already other treatment like EPO, but in the patients who did not receive this treatment. So transfusion-dependent patients with different types of MDS can achieve transfusion independence when treated with luspatercept. That is a subcutaneous drug that has to be given anyway in the hospital, but every 3 weeks, so the patient doesn't have to come so often to the hospital. So we are waiting for results of this study in treating a patient, non-transfusion dependent patient with the same drug. So this would be, again, a very important step for them. And then a week ago was approved another drug that is imetelstat. Imetelstat is a drug that has a complete different mechanism of action, but again, the patient who could take advantage of this treatment are the ones with lower risk MDS, transfusion dependent, who are not eligible, who received and relapsed after EPO. And it is an IV drug. That means that the patient, again, has to come to the hospital once a month, every 4 weeks. And the drug is inducing more than 45% of response, and especially long response, with a duration of more than 1 year for 18% of all the treated patients. So the management has to be there for the IV infusion, so the patient has to come to the hospital. But indeed, the durability of these responses are very important and relevant from a quality of life point of view. These patients are patients who have to be controlled and a little bit more than the usual low-risk MDS patient, because this drug could give thrombocytopenia especially, and therefore the patient has to be checked for these, for the counts and for recovery of the counts in between cycles.